Something else I wanted to ask you about is this isn't just necessarily for if you have breast implants. This works for because many people have issues with other implants within their body. My son has,
Yeah.
you know, metal plates and screws from breaking his femur. My uncle has a hip replacement, and they're all kind of struggling with, you know, autoimmune like symptoms since getting these devices in their body. So something like this could be helpful for them as well, right?
So I have to be really careful in saying this isn't, I'm not saying that this is for autoimmunity because that's a disease,
Right.
but people who develop autoimmune disease, usually they're missing a lot of these substrates. So typically they have leaky gut. So there's going to be like a big sleeve of this formula. So you know, these, you can think about these concepts and think, okay, this is why someone who has a hip implant or other implants doesn't have this response. Well, what's going on before? You have like a leaky gut typically, and everyone who expresses autoimmunity usually has some underlying leaky gut. So they have this interrupt the tight junctions, and then you know, there's a whole, we could go on. So a big part of what this formula is doing is it's helping to support the gut with regard to, so careful I cannot like
what are the specific ingredients that help with gut?
So if you look at the immune modulation blend and the collagen response blend, they both have ingredients that are anti-inflammatory. And remember, gut histamine can be a big driver of problems and like inflammation in the gut. So, but then what the first lead, the immune modulation blend. So you have leaky gut. So typically you want to get your glutathione system and your T regulatory system working really well to basically when you have an autoimmune process, you have these immune cells called T regulatory cells, and what their job is to police the T helper cells. So a T helper cell will pull off a piece of your tissue and say, hey, we think this is bad, like let's make antibodies against it. We think this is a foreign invader or a pathogen. And then the T regulatory system will say, no, it's not. It's not. It's self tissue. You know, we're not making antibodies. But in somebody who's missing these substrates that recycle glutathione and support T regulatory cells, then their T regulatory cells might agree. And then also there's usually a genetic component as well. I should probably mention that. And then there's usually a trigger, which in this case, we're talking about an implant as a trigger. So that's all happening. And then the T regulatory cell will say, yeah, we agree that that's a harmful thing. Let's make antibodies against it. And the next thing you know, you're making antibodies against self tissue. So in a person that has that kind of, the stage is set that way, we want to make sure, and if their gut is leaky, they could be eating like the substrates to some extent, but they're not absorbing them very well. So there's a bunch of things that recycle glutathione. I put them all in the formula. I didn't put glutathione directly because I don't like to use glutathione all the time because I want your body to make it. I want your body to make it endogenously. So if someone has a really bad autoimmune flare, it could be really great to give them a little bit of glutathione. It can really help their symptoms in the moment, but as an ongoing thing, I would encourage them to make it. And then I also put the fat soluble vitamins. So you have a combination of, we're working on gut inflammation, we're working on glutathione, we're working on T regulatory system. Does that, did it answer the question?
Yeah, absolutely. And there's always, is it best to take it with food, on an empty stomach, morning, night? What is your recommendation?
So I like think of this like food. So you can take it with or without food. There's a tiny bit of zinc. I doubt it's gonna kick off anyone. Sometimes zinc can cause nausea on an empty stomach. So if you're really sensitive, try taking it with food. You can start with 1. You could take like up to 6 a day probably and be fine. I wouldn't take 6 a day forever because it's maybe too much, but you know, I like to work with supplements really intuitively, and sometimes you kind of can feel that you want more of it, almost like, I feel that about my Noxaline. I have another supplement that I really want to white label one eventually, but it's called Noxaline, and it's extract from shiitake and rice bran, and it helps to increase your killer cell count. And I just love it. Like I want to take them all day. It just feels so good to take them. Wow. So if you feel that way, and when you open it, you're going to see that the capsule is purple, and that's because it's made it's made out of purple carrot powder extract.
Pretty.
So it has carotene. Yeah.
Oh wow. Okay, so you can take more than 2.
You can, but that's not, I'm not really saying that.
Okay. You're not
I mean,
saying
I have
that.
to be like really
I'm just
careful.
saying if someone like me took it and wanted, but all of the ranges are with, I mean, I take higher doses of certain supplements
Yeah,
anyway. So
yeah, and me too. So a lot of these ingredients I take in higher doses daily, like especially from the collagen response blend. So, but remember, we are women who had breast implant illness and
right,
still to some extent do. So that's not really who this is for.
right.
However, if you have breast implant illness and you want to support your body while you're going through the other bioindividual care explant, this is going to be very helpful too. This is also really helpful after explant because you have microsilicone from gel bleed. So all of those same things are still happening. Just because you remove the implant doesn't mean that you don't still have foreign implant in your body. You still do, unfortunately, so.
Absolutely, absolutely. And that's then when you are able to start more heavily detoxing. And so being able to support your body in the best way possible is this is great. And I love this so much because it can get really overwhelming. I mean, I worked with, functional medicine doctors and naturopaths and all of those things and my supplement cabinet looks insane. So that's really overwhelming for people to see. And if you don't know where to start and you need something that everything's kind of been figured out for you, this is incredible. And I would have loved to have been able to have something like this
and
available.
It's also like kind of cool because there's a synergy happening. Like I can tell you, I added certain ingredients that help like to work better with other ingredients. Like for example, in the immune modulation blend, I added PQQ. There's only like, I don't even think I had to write that as a claim. There's probably 1 milligram of PQQ, and I only did that because I wanted to offset the glutamine, because sometimes glutamine can become a little bit like it can sometimes be a little bit of a like reactor, but probably not in the women who are supposed to take this. So I knew that women with BII were going to find it and try it, so I wanted to make sure that I use these actives synergistically. So it's going to be a little different than taking one by itself. But right. Yeah, with you. And then once you get used to, you're taking all these things for a while, and then you're like, okay, I want to continue to maintain this, but I don't necessarily want to take a million things every day that are high dose. So you start to just microdose. It's great. It's a really like low dose of everything. It's meant to be taken ongoing. So yeah.
Wonderful. And then I would love to hear, I try to give women different resources and ideas of ways they can support their body, especially if they're struggling with BII or with breast implants in general. What are some other ways that you found as far as through nutrition? You've got your product, different things, exercise or walking or lymphatic massage, or what are some of your tools that you found?
I'm supposed to be like writing this as a book. Like there are so many things I do and have done. Oh my God. Like I'm going to tell you though, there's some really basic things like blood sugar regulation can really make a big difference in symptom management, because what happens when you have when you have chronic illness and you have dysfunctional pathways, like, yeah, we all know carbs are gonna like spike our blood sugar, and thanks, Peter, hi. We know that certain foods are bad, but what we don't understand is that when you're young and healthy and regenerating like at a rapid rate, you could eat like all the sugar in the world and you might not even have like much of a spike from it. You might not. But that starts to develop over time, and when you have chronic illness, you're going to be usually really sensitive to sugars and carbs and things that will spike you. And then what happens is you start, like something I'm starting to really explore now with myself, if you can keep your blood sugar really stable throughout the day without these really crazy spikes and drops, and just knowing that you're going to be someone who's more sensitive. And as a woman, there's times of the month when you're more sensitive to sugars. So like and when people like love to romanticize sugar cravings before your cycle, like, oh, this is when I really crave it and it's okay. Well, actually, the reason you're craving it is because you're more sensitive. So you're spiking more from the foods you eat. And when you spike, you drop below baseline. And when you drop below baseline, that's when you get a craving. So that's why you're having cravings. It's not because you just need it and it's okay. Even though that week of the month, I'm not saying I don't support you like loading food and doing what you need, like if you need it. But I'm saying that it's sort of an illusion. So this craving is really just created because you're more sensitive. So if you take that week of the month in a normal woman and then you expand it to all the time for women with chronic illness, like you could be doing a lot of damage just by eating. So it's just like these simple things. If you can get your body, I'm wearing a continuous glucose monitor, which
I want one. I think like if I could, I would buy one of those for everyone so that you could do it for 1 month, because it's like, it's invaluable data for you to understand how food affects your body. And once you know that, you could pretty much keep your glucose level by doing that. And it's kind of difficult to get one of those without a prescription, right?
Need a prescription, yeah.
Yeah.
Unfortunately. But if you can get a prescription, they're like, this is Freestyle Libre. It's like one of the most affordable ones. They have a trial program where you can get the first one for free. So if you just want to try it for 2 weeks, you can try it. And then you could, I think they're like $100 after that per monitor without insurance. So
okay, well, that's not terrible. Some of the other ones are like $300 a month, and that's just not feasible for most people.
Yeah, because this one, like, you have to manually take the app and scan it when you want to know, and then otherwise it'll check in on its own like periodically. And then the ones that are more expensive, you never have to scan, and they just constantly give you an update, which can be really useful if you're diabetic.
Right.
But if you're really just trying to understand like how the foods affect you, okay, let me think of some other great tips that I was just like, really depends on where you are in the journey.
Yeah.
A lot of it is so spiritual or like out there, but like this hypervigilance piece, like I don't know, and I'm gonna just tell you because like you and I are both medical detectives, so I get it.
Right.
I have said and still say that my hypervigilance is like a superpower.
Yeah.
However, it's not without consequence, right?
Mm-hmm.
And then people are asking me, well, like this is how you're wired. Can you ever not be hypervigilant? Probably not. You're always gonna have that side to you. It's always gonna be accessible. But like, what's the flip side of it? So if the flip side of it, which is relaxing and just be like sailing and having fun and not like worrying about the moment or the being in the moment. If that's a muscle too, if you have hypervigilance, like you can start to learn how to like strengthen the other muscle, which is the opposite of it. And that's how you really detox. That's like the only time you're gonna like actually be detoxed. You can get really ahead by just taking it easy.
Yep.
And that, you could be like bedridden and not be relaxed because you know you're miserable and you're like really in your pain. So it's just so important to figure out how to detach from like the pain and the story and like do, you know, exercise the flip side of hypervigilance. And I had another point. I went, so a lot of people after I made that post were like, well, what do I do about my hypervigilance? And I'm like, oh my God, I don't know, because I'm trying to figure it out myself. And this is something I've been giving a lot of thought to lately. And I started realizing, oh my God, it's just actually breathing. Like you just have to make a conscious effort to like deep nasal breathe like all the time.
Yeah.
And that's going to naturally decrease your sympathetic tone. That's pretty easy, right?
It is. Well, it's my favorite, which is it's always comes down to the most simple thing, right? And for me, being able, and one of the first things that I tell women is, because they're in such a state of anxiety or stress or fear, when they discover that it's probably their breast implants causing their issues, I tell them first, you know, now you're informed, you take that as data, you relax. I don't promote, I had to leave some of the forums and things because I couldn't continue to see these toxic bags and skull and crossbones and all of these things with, you know, the toxic chemical soup of implants, because it was putting me in such a state of fear, and you cannot heal when you are in a fear state. And so as soon as you know what you need to do, you are already healing. And so being able to just stop and breathe and meditate and start envisioning yourself, you know, in that fully healed state, I find that it expedites your healing. It reduces that stress response, and it's like, okay, I can do this. And it's just, I feel like that needs to be talked about so much more in
Yeah.
just breathing and knowing that there are so many things you can do to heal, and just by breathing and being still, you already are miles ahead. So
Absolutely. Yeah. Yeah. And, but like,
yeah,
you know, I'm one of those people, like, I can't just have someone tell me that without them explaining and grounding it and why. So these
right,
simple things like the blood sugar monitor, I'm like, yeah, of course. Like, I know carbs are gonna spike my blood
right,
sugar, but just to really see that when you're someone who's gone through all of this and that your organs and your insulin, your mast cells are primed and your insulin is primed, it's like your pancreas. Well, that's what happens with diabetes too. You know, you like eat like a bag of cookies one day and then your pancreas secretes a ton of insulin, and then the next time you go and you eat one cookie and your pancreas is like, she's going to eat a whole bag, so let's just go ahead and get all the insulin out. So then you start putting
right,
out, you know, stuff like that. It's like understanding that our bodies are different. We're not working the way, so your friend who can handle it, you probably can't. And just testing it is so fun, and you start to realize, oh my god, if I don't have any carbs at breakfast, if I just have, and I don't mean carbs because vegetables are fine, I mean
right,
like sugars, real
right,
sugar, and you just have like a protein and some vegetables and some coffee that doesn't have a sugary nut milk or sugar added, you set your day up for success. And then you can have dessert after dinner, after you had protein and carbs and, like, you know, got yourself, you know, slow it down so it doesn't hit your blood super fast, cause the spike, cause the inflammatory insulin. By the way, insulin is very inflammatory when it comes out like that. It can kick off your pain. It can do a lot of things. Oh, I'm trying to think what else was really helpful. Okay, so we talked about
I bet I
hypervigilance.
have a question about that. I bet that you start to be able to connect how you feel based on where your, you know, if your blood sugar has spiked or where it's even, so that just by wearing that for a few weeks, you are able to go, I'm feeling this way.
Yeah,
This probably means my blood sugar has spiked, or I'm
yeah,
feeling this
yeah, yeah.
way. Have you found that to be true?
Absolutely, because there's other things that can do it, like stress. So if you get like, if there's something, if there's a trigger that makes you really anxious or really stressed, and like it's not going to be just the insulin that you're feeling, or the blood sugar spiking. It's going to be, well, blood sugar spiking can sometimes feel really good for a minute until all the
Right.
insulin's. It's like, I don't know why. It's like very unfortunate. But so like, let me think of an example. Something like really, I was talking to like my ex-boyfriend, and I get this horrible feeling whenever I talk
Yeah.
to him. And I test my blood sugar. Sure enough, it's starting to spike.
Really?
Yeah.
Wow. It's just, yeah, shows how emotions affect everything.
Yeah.
Wow.
And of course, there's other things happening too. Probably like there's adrenaline and there's adrenal things, but you know,
Right.
the adrenal glands and the pancreas are really like incestuously related. I mean, they're definitely like siblings, but you know, they
Right.
work together and they talk to each other and they secrete based on what the other one's doing. So, which is all great if you have to run away from a predator.
Right. But generally that's not what we need to do. We feel like we're in that fight or flight response. And
So to build on what you said about like learning to tune into the feeling and what that feels like, that's an important thing to mention too, because something else that can happen when you have chronic illness and VII is that you become very sensitized to pain, and you become, your brain gets really in the tissue so much that like you're hyper aware, which can be a problem because it can like, you can heal the underlying causes of your pain and then you can still have pain. So a lot of things that I've had to do is work on rewiring pain in my brain, and I found some really great ways to do that, like IV Procaine. So I'm not going to say like do it because this is not medical advice, but what I did is I did these IV Procaine infusions, which is sort of like an off-label use. It's 100% an off-label use for Procaine, but there's write-ups and there's literature and there's studies about it that when you put it in an IV, and Novocaine works to some extent, but Procaine I believe is better. So if you're working with a naturopath or an integrative medical doctor, nurse practitioner, whoever does IVs for you, and you can bring them literature. So go research on your own, find literature about IV Procaine, bring it to them, show it. This is how I got this done too. I had to, you know, they can figure out the dosage. You do a small infusion and it actually goes into the brain and it opens up the pathway, the dopamine centers in the brain, and it can actually change your relationship to chronic pain so that you're not constantly sensitized to it. So that was like a big one for me. It helped me a lot with chronic pain.
I had Procaine injected into my explant scars.
That's different, but good.
Yeah, but
Totally
yeah,
different.
it was
Totally different.
okay.
But totally useful. Explant scars. So for scarring, there's this machine called TRT, or they call it soft wave. And a
Mm-hmm.
lot of clinics have it all over the country. It's a really popular company. It's a sound current that will literally break scar tissue. So I
Oh
spend a lot
wow.
of time using that on my scars, and I don't have, like, I barely have scars because of all the things we talked about earlier. Barely scarred,
Right.
but it can really be effective. And so sometimes you see like the visible scar, but then underneath there can be a lot of like haphazard collagen, and like what can end up happening over time. This is something we should talk about. You have you can't see my chest. You have the scars right here. So what ends up
Yes.
happening over time is, this is a fascial plane. It's also an energetic plane. So it starts to pull you forward and in. This is
Yes.
what happens. So you want the opposite to happen. You want the scar, actually, you want it coming up, and then there's stuff
Right.
going over here too. So you working with the soft wave machine can really help to retrain the posture. You don't want to, you can develop a postural syndrome after explant. Scars have a lot of energy. They can pull the body forward and down. I mean, it's
Yes.
real. So
Yes.
working on the scars is important, not just for aesthetics, but for like your entire body.
Right. Right. Maybe and I also had prolozone, like, which was
Mm-hmm.
supposed to be for
Yeah,
helping like energetically like release
absolutely. Phenomenal. I've done that. I did that in my TMJ in the neck. It did help a lot. But it's really different, but it's not so different. So like, it's going in that situation, it's interrupting like a cycle in the trigger
Right.
point. But when you use it in an IV, it's going into the brain and it's opening up.
Wow. Okay.
So,
Wonderful.
so you know how we've like used antidepressants for pain syndromes? Like, I don't know if that ever happened, or anyone tried to put you on one. There is actually some, all right, I'll admit there's some like merit to it, because you have a lot of like these neurotransmitters in the peripheral tissue, like
Mm-hmm.
serotonin, and it can really like affect pain for, so it's a very like complicated, interesting relationship we don't fully understand. But like thinking about opioids and cannabinoids and how all these things act on like these feel good neurotransmitter feelings, which are also like the other side of the coin of pain. So
Right.
bring into the brain and rewiring that where it really happens holistically with cocaine. I mean, I don't know if that's technically holistic, because it's still like a pharmaceutical
Well,
intervention.
I think it's being used in a holistic way. Like I take LDN.
Yeah. Oh,
So
great. I was glad you mentioned that. And do you
yeah.
have autoimmunity? Can I ask?
Yeah, I have Hashimoto's.
Okay,
But
so the
it
LDN.
is so which I think I was hypothyroid like the entire time I had breast implants, but on the regular labs, they would say, you're almost out, but you're still within range. And then when I finally saw a functional medicine doctor, they were like, whoa, you're hypothyroid. And then eventually I had my antibodies tested and they were like, oh, you have Hashimoto's. And so I just had my blood work done on Monday to see where those antibodies are at, since I started on the LDN and some other things like, adrenal complex and different things, just trying to regulate
Yeah,
everything else. But
yeah. I
yeah,
would love to
so
hear.
so that's technically a pharmaceutical, but you're using
Yes,
it at such a low
totally.
dose, and it has these incredible positive effects on your
Mhm.
system versus traditional use of pharmaceuticals. So, and I haven't taken anything other than birth control, which was a whole issue, but I've been off that for 4 years. But I've never had to be on any type of pharmaceuticals, and right now I'm not on any thyroid medication. We've been able to to balance that all through nutrition and supplements. So, and hopefully with the
Yeah.
LDN keeping us there.
And there's a very unique relationship between breathing and the thyroid too. So that's like a whole
Yes.
other term. So this all kind of ties together. But definitely, like, I would want to introduce you to an experimental peptide that helps with the leaky gut trajections, that I'll tell you about it later. Uh,
Yeah.
but
Yeah.
it's being studied in celiac and ulcerative colitis, and I think Crohn's, because it really helps the gut. But I think that could make an impact in the thyroid autoimmunity too. But there's so many things to say. I don't want to know how.
Right. Well, we definitely need to talk. I was going to mention, say on here for anyone that I started following Glucose Goddess, and just the
Yes.
information that she has on there is really great. If you're not able, I haven't been able to do one of the glucose monitors, but it's my next thing to do, because I know that once I have information, just like wearing this Aura ring, I understand my sleep cycles. Yeah. I mean, this thing has just been amazing. And
Amazing.
now I understand, like, based on my hormones, why I don't get deep sleep at certain times of my cycle, and when I ovulate, and everything, how my
Yeah.
body works, just from this little dashboard that you get from your sleep and your respiratory rate. And you know, I'm working on my HRV. I have very, very low HRV, even though I lift weights and I do hot and cold therapy and I do all of these things. So I'm trying to increase that.
Well,
Trying all these.
there's a really great heart like training tip that I learned from one of my mentors, and it's really cool. So it's simple. When you do cardio exercise, if you this is the recipe. So you do like about a minute, 60 seconds of max heart rate. So you go as hard as you can.
Mm-hmm.
Then you stop. By the way, you have to be aware of what your heart rate baseline is. You
Right.
wait until your heart rate comes down to its base. I mean, I'm not saying like I'm just down to complete base. So you wait.
Right.
If it takes 4 minutes, you wait.
Mm-hmm.
A really healthy heart will return within 30 to 40 seconds. But if you're
Really?
not returning, then that means that your heart is not in optimal condition. So the way you get it better is you keep doing these interval training sessions, but you have to wait until it fully comes down before you do the next interval. Because if you don't, or if you're doing distance cardio or you're pushing, you're actually just extra stress on your heart. It's not actually training. So once you get your heart to a place where it recovers from a max heart rate interval, when it comes down to 30 or 40 seconds, then you're ready to do it again. And then that's how it'll get stronger over time. That's the recipe.
Oh,
So
wow. That's amazing. I'm definitely going to do that tomorrow when I work out. And I had major heart issues when I had my breast implants, and I had a heart monitor. They did stress tests, they did EKGs, and they couldn't figure out why I was having these just crazy palpitations and everything, which all, that resolved within 6 months after explant. So
yeah, I'm in the same boat. I have a lot of like cardiac issues ongoing, but I just know like there's things that happen, and it's like going back to insulin and insulin desensitivity. You know, we've been through a lot, okay, and we're probably going to like, oh, and we're also aging at the same time. So this is a curve happening, unfortunately. A grid of, anyways, yeah, we're gonna need to always probably like baby at these things. But yeah, the heart, my heart.
So this could help. So this can also help, because the other thing that I notice is I have more skin laxity than I should for my age.
Oh, this is made to tighten. I don't really have a claim built around it. I'm working on it.
Right. But it would make sense in what you're saying with my histamine issues, with me having thin capsules, and for me starting to have, while I had my implants, I was having like major skin laxity on my neck and my arms and my stomach and everything. For someone who never really, like, my weight has been pretty close to the same since I was in high school, other than I had babies. But, you know, I've not ever had such huge weight gains that I should have this skin laxity issue. So this is all making so much sense.
Yeah. So people that I've given this to who don't even have breast implants have told me that their skin looks tighter within a week, and like 7 or 8 days being on it. Wow. And it's not going to happen for everyone, because not everyone has skin laxity caused by histamine. But if you do, you will see a difference. Like, there's no doubt.
This is the first time, and I have studied and researched so much, that I've ever heard a connection between the two.
I know. I mean, I don't mean to say it like that, but
no, thank you. This is incredible, because everything's connected, but there's just, I don't think that has been, you had that aha moment. Yeah. And I don't know that would have happened had you not been through your journey and experience and your knowledge and what you were studying and all of those things together.
This has been like, that's why when I had the aha moment and I was like, oh my God, you know, and now I'm trying to convey that to like our community, and it's like, they're just like, what? I don't know. Thank you so much for just understanding it, because you're so smart, and with like the sprinkles of hypervigilance that I see in myself and you, and I love it, because it's what makes us go out and seek and never give up and fight and fight and fight. Okay, but thank God we're doing this, because not everyone can do it. We're not all wired this way. So it's beautiful that you're doing it. I'm so like happy that you get it and you understand the formula. Thank you so much, because it means a lot to me, because it's like I figured this stuff out, and now I have the job of trying to now convey it. It's not easy.
No, I know it's not. And you know, so many of the women that I talk to, you know, they have little babies, they're moms, you know, they have extremely demanding careers, and they don't have time to research this. They know there's something wrong. They have pretty much connected it back to their breast implants. Explant is not an option. So they're like, what can I do? Because the only things that I can find are like, you know, just get an explant. Well, that's not helpful to the majority of women. And so
Yeah.
that's why I was so excited when I believe, you know, the synchronicity and how this all kind of came together, in that the person that was interviewing me and that I have a history with Julien with Fox Force Media.
Yes, yes.
And
yes.
so, and that was where, and I don't know that I would have felt, it's
like
interesting because Julien and I did a photo shoot together on the day that, like, was first day that I went back out when I switched to silicone implants. And so I was still not feeling very well just from my surgery. And then I moved and different things. And then the next time I saw Julien is like 7 years later on the red carpet. Whoa. And she's interviewing me, and I was so sick. My mom had driven me there. I was trying so hard to like just focus, and I was getting cast names wrong and everything. Right. And then I just decided I'm going to tell everyone that I am sick from my breast implants, because I never knew that it could possibly be from these. And right. So I felt comfortable enough because it was Julien. And then she tagged you on something, and I was like, what? And then I watched your thing, and I was just like, this is what I've been looking for. This is what I've wanted to share with women.
So if you look at the legislation and what's happened, it all happened really quickly. And so now we're in this really crazy, awesome place, but it's the FDA has just decided that they're going to mandate to all the surgeons. This just happened last year. So now all these surgeons have to do this informed consent. And the ones that you're talking about, they're so upset, right? And I'm trying to think about it passionately. Imagine that you go your whole career implanting women, and maybe you're doing it for the money, maybe you're doing it because you like it, I don't know. It's not like they're necessarily sitting there thinking, oh, I'm going to ruin their health.
Right, no. Right.
But then how do you like psychologically make that flip and say, oh my God, I might have done a lot of damage with my own hand.
Right.
My own ignorance. And then flip and say, but like, you know, with anything, if you could evolve through anything and pivot, I mean, this is what we need to encourage them. Like, it's okay. There's still a place for you. We love you. We love what you're doing. Go ahead. Give me a facelift. I want one.
Yeah.
But
well, we were all
but let's get on board with health with implants.
Exactly. You know, they were told they were safe. We were told they were safe. We were all misled, and you know, and there are some people that do totally fine with it, but it's becoming more and more, and it could be, I feel like it has a lot to do with environmental things going on that a lot of bodies just can't handle it now. Yeah. So you have to have extra support.
Totally. Our chemical exposure is going up. Our DNA is becoming mutated because we're being born of people who were exposed to tons of chemicals. Like, you look at our parents' generation, and they're way stronger than us. They really are. I mean, you can't deny it. So I wanted to say something about surgeons. It was just about, like, I really, really want to work with them. I want to explain to them that this formula is going to enhance their patient experience. This is not a threat. This is not a threat to them at all.
No.
There's a learning curve to understanding that, though, because there's liability concerns. You're like, well, if I sell this to my patients that I put new implants in, am I going to have to answer to all the women I put implants in the past that I didn't sell this to, right? I don't know the answers, but
I don't think so. I think it's like anything, you know, we grow, we evolve, we're learning more. Science, you know, discovers new things. And so it's just part of the evolution of science and medicine. And so we can't just hold on to old ways, even if those old ways are making us sick, because we're like, oh, we can't admit we were wrong, you know.
But like,
It's so great.
and yet there are a lot of surgeons who are doing just that. There are like this phenomenal group of explant surgeons, and
Yeah.
they are doing just that, and they're okay with it. Like, they're not all in their ego about it, and they're just like, all
No.
right, best available information. We know better now. We can do better. Cool. Let's do it. Let's get on it. Let's not gaslight women who come to us who are sick. And by the way, if you're sick, a surgeon is usually not the person who's going to tell you if it's, they are not really doing internal medicine. Remember that. They're not internal medicine doctors. They're not immunologists. They're not endocrinologists. They are surgery specialists. So yes, they went to medical school a long time ago, and they may or may not be keeping up with it. So like the good ones obviously are. Oh, and I have one more story I want to tell you. I have a friend who got breast implants like over 10 years ago, and she went to some surgeon in Florida. I don't remember his name. I should know. And he did blood work on her, figured out that she had some immune reactivity, and basically was like, I refuse to give you silicone filled implants. I will give you saline, but because of your background. Okay, so this is before all of this information. This is because he was drawing from the 90s. He knew about the autoimmune affiliation, and he was running his practice that way. He was just being extremely careful and responsible. I mean, wow, like that's happens. There's people all over the country potentially who've been practicing that way the whole time. They're just really responsible doctors. How great, right?
Well, that's what I was so blown away by Dr. Rob, is because he has studied, and once he started seeing there was issues, he began looking at why, and studying holistic methods, and understanding, like, if I give them these supplements, this helps with these methylation issues, or these, you know, gut issues, and seeing that by downregulating, you know, this auto or this inflammatory response, they were able to do better, to recover quicker after explant surgery.
Totally.
So it's really incredible. And he has, like, you know, implementing the lymphatic massages and different things like that. So there are doctors that are catching on, and Dr. Thing, is it, who has her whole thing. And I had women saying, I'm crying, and I'm so shocked to hear a doctor talk this way when I asked him what's the #1 thing women can do now if they're struggling with BII or they're preparing for explant. And he just went straight into nutrition. And, you know, eating organic, avoiding glyphosates, eating grass-fed, wild-caught fish, removing processed foods and anything that could be inflammatory, like dairy and gluten, for now, until you have a food sensitivity test to see if you have sensitivities to those issues. And there, women were like, what? A doctor talking about this?
So, no, of course, phenomenal. Right. We're starting to realize that these things are related. Like, oh my God. But and I don't disagree at all with his advice. Like, that's great advice. But I have to tell you, like, in my journey, I was so sick for so many years and no one knew why. And everyone kept saying, it must be your diet. It must be your diet. So I tried every diet under the sun. I was a vegetarian my entire life until I was 31. I started eating meat at 31, never having it in my entire life. It was very bizarre. It was like what I imagined cannibalism would feel like if you had to start eating other humans. Like, that's really what it psychologically felt like. It was really hard. I did all this stuff. I went gluten-free, I went dairy-free, I tried this, I tried that, and nothing helped. Nothing.
Right.
So it's hard because it's good advice.
It is hard. But a lot of people, if they are eating a bad diet or whatever, and I was eating a very good diet, but I try to always be like, what are things that people can do and change now? If you're already doing that, then you know that we've got to look at other things, but it's a good starting place to at least, like, not be eating Twinkies and drinking soda and doing those kinds of things.
And I saw that, like, I have a colleague that I was sending all the breast implant illness patients to that came to me, and I kept, and this was like a few years ago before I like really came to where I am now, and he was just not recommending explants, any of them. And every single one, I'm like, why haven't you told, you know, Stacy to go out? Like, why are you not, like, you get it. We've talked. And he just kept telling me, like, well, we've been doing this and this and this, and they're seeing improvements. And like, I just really was like, I had like a block about it. I had a block about understanding that there's more ways than just one to help, and that not everyone wanted. And a lot of them, like, I didn't even know, I thought I was blaming him, but really it was the women too that didn't want to explant. So they were explore. So if you can, like, so yes, if you have like a really bad lifestyle and diet and you have implants and the implants are causing problems, you can definitely there's things you can try.
Yeah, that's a good place to start. But that's my thing is I don't judge anyone, and I understand sometimes, you know, I got implants because I was bullied so severely in school, and then eventually after breastfeeding 2 children, I was completely flat. I had lost all of my breast tissue, and so it was something I did love them for a long time because I felt like I looked feminine, and because I am athletic, you know, I felt like I had more of a masculine body because I had absolutely no breasts. So I understand that, and so but I want to be able to be like, if you want to keep your implants and you want to make sure you're supporting your body as best you can, this is a great option.
Yeah.
If you want to keep your implants and you are having issues, this is a great place to be able to and it's affordable. You know, a lot of times when I can't even imagine if you were to try to put all of these things together, you're easily looking at $300 a month.
These are really ingredients. One of the ingredients in this, I won't say which one, I had added like $5,000 to my run on 2,000 bottles just to add this ingredient, which is a lot if you're not familiar. And I did it because I know it really helps. And I'm hoping that it continues to not be classified as a drug, but that's all I'll say.
Yeah. Well, that's why I just thought I really resonated with this and was so excited to talk to you. And you're just a wonderful human being, and this is really amazing, and I'm so grateful that I got to talk to you, and I want to talk to you more outside.
Yes, we'll talk
about
more.
and pick your brain about all those things.
Yeah, but I'm happy to help, and totally. This was really great. And again, thank you so much for just I love your perspective. Like, it's so refreshing.
Aw. For those who are transgender and have, I feel like that's not discussed enough. The fact that you know, they're struggling with issues as well. So, you know, I do say women a lot, and all women who have breast implants.
People who have silicone device in their body. So
exactly.
It also works well for injectable freeform silicone, which is not like people are doing that quite a bit.
Right.
Especially in Miami, it's like they inject silicone into their butt. But I also met like a lot of women from, like, in Iran, it's common practice to inject freeform silicone in the lips. So and people are having the same health problems. Like, breast implants are the loudest voice, but we use silicone devices for all kinds of things. And yeah, in LA, like, there's so many men getting like chin and jaw implants. Like, so
they put cheeks and calves and all kinds.
But I feel like the face ones are, I'm just like really shocked at how many men. I just think that it's really common now to just, if you're a man in LA, you go to a plastic surgeon for something, and then they just say, hey, I could really balance your face by giving you this and this. And, you know, sometimes it's fine. Oh, it's something so interesting, and I know we have to go, but I had a patient who had a chin implant from 15 years ago, and then someone injected Voluma on top of it. And I think the Voluma disrupted the scar tissue capsule or caused some sort of like immune activation, because then she started having a lot of symptoms after. But then it was funny because, like, after we did diagnostics and scanned her and like investigated more, we realized it was a tipping point event, and she was really compromised. She had really high cadmium levels. Her liver was shut down. Her biliary system was shut down. And trying to explain to her, because she was like beating herself up, like, if I just had never done Voluma, I would have been okay. And it's like, well, something was going to come along and be the straw that broke the camel's back, whether it was the implant or it was Voluma or it was, and then, by the way, like, I wasn't even familiar that Voluma could cause problems, and I'm not convinced it did. I could make a case for how injecting into a capsule could cause a problem, right?
Right. I don't think that's been studied at all.
No, of course not. Why would you bother studying that? Who cares?
Right. No.
I'm totally joking. Like, that's like pharma. No.
But yeah, but I mean, I don't even think, like, it just occurred to me when you said that, like, I never even thought about the fact that, yeah, you would have a capsule around anywhere that you've got a silicone implant.
Yes.
Wow.
Yes.
Amazing.
Yes. And I know another patient who has one here, and she has a very weak jaw. Like, it looked a little weird before. And then what happens is, over the years with the implant, and she's super autoimmune, and there's a lot of inflammation here, actually. And she knows when she removes it that there's going to be even more atrophy to the area.
Right.
it's
Which
very
is
hard to tell
interesting
her.
because that's all by your lymphatic here.
Oh
So
yeah,
that kind of
yeah.
blocks your lymphatic drainage there, right?
But do you see how, like, that's her face? How do you convince someone that they need to take that out? It's really hard. And
Yes.
I understand, like, and it's gonna look worse than it used to. And then she's, I mean, there's stuff she could do. There's ways she could rebuild it. So, but you know, again, these are like the types of situations people can be encountering. And
Right. It's a lot. Well,
all
this
right,
has been wonderful.
yes,
And I will leave your information so people can reach out and ask you questions and check out your website. And I'm going to share the little mini doc because I think it's fascinating. And I think the people that are saying that it's too long are not people that have breast implants, because anyone that has breast implants, to hear a doctor's perspective who had breast implants and had issues is so refreshing, and just like you feel like, oh my gosh, a doctor understands.